In most settings, mask mandates have ended, and from school to shopping centers to places of worship, it's mostly up to the individual to decide how to protect themselves from the current highly infectious variant of COVID-19. Justin Chandler covers the Hamilton-Niagara region for our Ontario Hubs, and he's been talking to medical officers of health in the province about helping people make good choices. Hey, Justin.
Hey there.
All right, so mask requirements were removed in most settings on March 21st in the province. What are some of the repercussions of the March 21st lift of the ban?
Well, one thing that all of the medical officers of health that I spoke to agree with is that once masking became optional rather than a requirement, a lot more people stopped wearing masks. Before, pretty much everybody was wearing them in all the settings. They were required to. Sure, maybe some people didn't, but that was the rule. And once that rule went away, what the doctors that I spoke to said was that it maybe gave people sort of a signal that things were more okay now. If it's not necessary, maybe you don't have to do it. And it also gave permission for the people who never wanted to wear masks to begin with to take them off. So consequently, it's not a requirement. We have far fewer people wearing masks. And I think most people anecdotally would back that up just to what they're seeing in their daily lives.
I think what's interesting is in the first month of sort of the ban being lifted, it was regular conversations to be, I walked into a store and I saw it's 50-50. Oh, there was a few people with their masks on, there was a few people without. I want to talk a little bit about a few of the regions that you spoke to and the people there. You talked to a few medical officers. Let's talk about Dr. Nicola Mercer in Guelph. What did you learn from that conversation when it came to sort of further restrictions and conversations about the mask ban?
Well, I would say of the doctors that I spoke to, Dr. Mercer was probably the most in line with what the province is doing here. What she had to say essentially is, yes, we're seeing an increased rise in cases. She said we saw probably a surge that would have happened anyway, just given the time of year and the course of the pandemic, and that coincided with masks coming off. So she said masks do make a difference at a population level. She hasn't linked taking off masks to increase transmission, as some people have, but she has said that what we're seeing here was not unexpected. I think the science table in the province both said the same thing, that we were going to see more cases as restrictions eased. But Dr. Mercer seems to think that for the most part, this is manageable. She says that we've got lots of protections in the community and in her area in Guelph, Wellington, Dufferin, Guelph, that things are going relatively okay.
So fair to assume in that region there aren't any ideas beyond reintroducing masks in Guelph?
No, that's correct. I asked her and she said she's definitely not prepping a Section 22 order. She said she would only do something like that to bring back masking if something had significantly changed. And in her mind, that has not happened.
All right, let's move over to Peterborough. You spoke to Peterborough's medical officer, Dr. Thomas Pickett. What is his plan to help in his jurisdiction to keep people safe as possible?
So Dr. Pickett is someone who has sort of a different view. He believes that getting rid of masking was the wrong decision and that if we kept masks on, that would be much better. Now, in his region, it's actually at their highest alert. Public health has a scale there, and they say sort of how high risk is right now. And they had theirs at the highest when I spoke to him. They've got about, at the time, 50% more hospitalizations than they had at the peak of the fifth surge of cases. So things were not doing so hot there, I think would be fair to say. And so he was saying that really he thinks people should continue to wear masks, and he's actually looking at maybe making that mandatory. So we discussed sort of how that would look. He said perhaps he could issue a Section 22 order. That's Section 22 is one of the items under the Health Protection and Promotion Act, which is the legislation that gives medical officers of health their power, and it allows medical officers of health to order people to do certain things based on particular conditions. So essentially, they could use that to make masking mandatory, as some did at the start of the pandemic, actually including Dr. Mercer, interestingly. So all this to say, Dr. Pickett has considered doing that. He says that there are some potential drawbacks, and he's not really sure at this point, but he's still advocating for people to continue to wear masks while he thinks about whether or not he's going to make that decision.
You had mentioned the high hospitalization rates in the area of Peterborough. What is Dr. Pickett saying about, long COVID, and not just, getting away from catching COVID, but sort of the long-term effects of that as well?
Yeah, he's been careful to warn that it's not just hospitalizations that we want to prevent, but actually just getting COVID is no picnic, and it's something that we should try to avoid. Long COVID is something that's still not terribly well understood in the scientific community, but we do know that there's a sizable portion of people who actually get COVID-19 symptoms, and that can cause issues that last longer than the illness. So people might find, for example, loss of taste or brain fog or these things that can go on much longer. And he said that this could even go to things that would affect the respiratory system, the circulatory system. So really, we're not just trying to prevent people from getting into hospital, but he says we want to prevent people from getting sick at all, because you never know if long COVID is going to stick around for somebody.
All right, let's move over closer to home for you in Niagara. Niagara's acting medical officer of health, Dr. Mustafa Herji. You've talked about him a few times on the show as sort of, the medical officer of your region. What has he had to say about sort of the masking mandates as well?
Yes, Dr. Hirji was very candid in our discussion. He says that having masks be mandatory is, his words were, a no-brainer. He thinks that absolutely they should not have ended as a requirement, and that doing so right now was the wrong call. In Niagara, the transmission has reached highs greater than previous surges, not the last one, so not greater than the fifth, but still things are quite high there. The hospital system has paused resuming certain services because they're worried about staffing issues. So he says that what he's trying to do right now is encourage people to wear masks, talk to organizations about how they might go about requiring masks if that's something that they want to. And he's pressuring the province to bring that back, while he also considers bringing in orders himself to make that happen.
Overall, were there any other issues that Dr. Herji brought up as well?
Well, as far as going about bringing masking back, if that's what he wants to do, he said he still wants to wait and see, to think about things and to see whether or not we're plateauing or whether transmission is going down in the area. But he did say that he's got some concerns about how the province might handle it if medical officers of health decided to go and put in local rules. So this is something that medical officers of health have discussed with each other, he says. It's also something that they've talked about how they might want to advocate to the province. But he's really worried that Ontario is essentially in a place politically where anyone who went against the grain might face some sort of pushback. And for this, he cited, say, a case in January where he tried to put in stronger measures in schools than what the province recommended, and he was effectively reprimanded by the chief medical officer of health. So he's worried that there might be some acrimony if someone like him tries to put in stronger measures. So he's particularly concerned, I think, about the direction that the province is taking Ontario here, and just what might be politically, not legally, but what might be politically acceptable, I guess would be the thing to say, as far as, just what the government's going to tolerate.
Justin, did Dr. Hirji or any of the other medical officers raise any concerns about the fact that potentially masks may be lifted in congregate settings like public transit and in long-term care homes in the weeks or months to come?
Yeah, we didn't get quite that far, but I think one of the things that they all agreed is that people should continue to wear masks in these high-risk settings. None of them said that people shouldn't. Dr. Mercer even said people need to think about what settings are high risk. So, for example, she said a lot of people don't wear them when visiting with friends and family. I think that would probably be pretty standard for most people, whereas she says that is still a very high risk situation. So I guess it's just up to people now to think about what they would consider high risk, not just for them, but for other people, because we know that masks don't just prevent you from getting sick, but it also can help you from spreading infection to others. So as things stand right now, where it is in all these regions, things are still optional. It's up for individuals to decide and to do that risk calculation.
Justin, really appreciate the insights. Thank you so much. Coverage from mostly across Southern Ontario. Thank you very much.
Thank you for having me.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.